And Germany's Chancellor Angela Merkel has called for European nations to work together to rebuild from this deadly pandemic. In the meantime, Germany's confirmed infections rose by more than 3,800 in the last 24 hours to more than 99,000, rising again after 4 consecutive days of dropping figures. The death toll rising by 173 to over 1,600. Joining me now is Professor Reinhard Busse, a physician and health economist at the Berlin University of Technology. Thank you very much for your time. Firstly, despite the high levels of infections, Germany's fatality rate, by comparison to, say, that of France, Italy or Spain, is very low. Why is this the case?
Well, we have had since the beginning a different strategy in approaching newly diagnosed cases. I mean, since the very first person in Bavaria in early February, we tested all persons whom we knew was in contact with that person and put them into quarantine. And that's why when you look at the overall number of tests in Germany and the percentage of positive cases, it is still below 10% or around 10%, meaning we have tested 10 times as many people, meaning also that we have a more complete picture of who is really infected, meaning we count more people as being infected who are younger, working age people who have fewer strong symptoms, who are less severely ill. And that's why you cannot directly compare our numbers with that of France. In France, for example, we see that many more persons are hospitalized in ICUs. We currently have less than 3,000 people in our intensive care units, and we see fewer people dying as a result of this more aggressive testing.
So, was Germany better prepared?
Well, I mean, in the beginning, I would say yes. I mean, we have two different to other countries. We were more aggressive in our testing strategy and in isolating contact persons who we knew were in contact with those who were tested positive. And we have, especially when it comes to ICU beds, we have more ICU beds available, which in normal times might seem too many, but in these times are reassuring that we have them.
So, what lessons can other European countries learn from Germany?
Well, I think what we can all learn is that we need a plan. I think many countries, including ours, we had a plan, but we did not really look at it. So then we had to be quick in catching up. We have to be better prepared for next time. And I think all our hospital systems, we have to learn better that we have normal times where we clearly have to say, okay, we don't need too many beds so that not too many people are put in hospital unnecessarily. But we need a plan how we can quickly increase our capacities. And in some countries, the capacities in intensive care are simply too low, and we need to better think for next time, not necessarily have them all the time, but that we can upgrade our facilities.
Professor Busse, we're going to have to leave it there. Thank you.
Thank you.